If you're like one of the 80 million people in America suffering from chronic back pain, I've got a quick melt map that I want you to try. I want you to lie on your back with your palms faced up and your arms and legs extended. In the Melt Method book, I talk about using body sense to try to sense what you feel in your body. There are 4 common imbalances that most people have that cause all of the stuck stress that ends up causing you neck and low back pain. Let's see if you can assess the most common imbalance in the body that causes your low back to have aches and pains from day to day. I want you guys to notice the middle of your torso. I want you to notice if in between your belly button and the bottom of your shoulders, if this region of your back feels like it's weighted on the floor, or if you're feeling the common imbalance of a big wailing arch. When you have no stuck stress in your low back curve will be between your belly button and your pelvis. If you're noticing a big arch, here's a quick sequence that I want you to use from the low back release sequence in the Melt Method book. You're going to bend your knees, lift up your hips, and place the roller underneath the center of your pelvis. Then you're going to start by hydrating your connective tissue. So you're going to angle your knees just slightly either to 11 o'clock or 1 o'clock and begin creating small circles with both of your legs. Try to differentiate this motion or keep it just to the pelvis. You can also try to circle the one leg that you're leaning toward, or if you really have a difficult time, just march both knees forward and back. Either of these 3 moves will create a fluid exchange in the tissues in the pelvis, and we're going to use that to release your low back. The secret is, once you've created what we call a shear motion, wait, and then release. Try the same exact moves on the other side, either creating small controlled circles with both legs, or circling the one leg that you're leaning toward, or marching both knees forward and back. This is going to juice up that tissue so that we can release your low back. And again, once you do a shear force, wait for a moment so that the tissue has time to adapt. The second melt move is called the tuck and the tilt. You're going to place your hands onto the fronts of your thighs, create gentle pressure in a constant way right to your hands, and slowly begin to tuck and then tilt your pelvis in this subtle motion. Watch how Hallie really keeps this movement isolated to just her pelvis as she keeps her thighs pressing into her hands and her ribs stable on the floor. The third melt move is called the bent knee press. Place one leg down onto the floor and draw your other knee towards your chest. In an easy, gentle, subtle way, I want you to try to tuck your pelvis under slightly towards your side of the roller and then gently create a nice tug by pulling your knee towards your chest as you gently push your foot down onto the floor. If you're doing it right, you're going to notice a nice tensional pull against the front of the thigh that's on the floor. Take a nice focused breath into the area you're trying to hydrate and then let it go. Try the same thing on the other leg. Again, set your foot firmly down to the floor. Tuck your pelvis towards your side of the roller so that we draw as much fluid as we can to the low back. Inhale and then exhale and draw a nice gentle pressure between your foot and your hand in equal tension. Once you've done those 3 melt moves, take your pelvis off of the roller. Let's assess Hallie's back and see if she's made a change just in these few minutes to her low back. Remember what her back looked like when we began and she had that big arch. Notice now how her back is more relaxed and settled to the ground. If you're suffering from low back pain, don't let stuck stress accumulate in your back. In just 5 to 10 minutes a day, you can alleviate some of that stuck stress and keep your back pain-free.